Welcome to the second in a series of 3 short videos from CoSRH looking at emergency contraception. In the first video, we discussed how to assess pregnancy risk. We are now going to look at how emergency contraception works. We have 2 types of emergency contraception: oral emergency contraception and the copper intrauterine device, or IUD, and they work in different ways. So you will remember that the exact day on which ovulation occurs will vary with the length of the menstrual cycle. Ovulation occurs 14 days before the next period is due. Ovulation is triggered by a rapid rise in the levels of luteinizing hormone, or LH, being released by the anterior pituitary gland. This occurs over a 24 to 48-hour interval and is called the LH surge. Ovulation occurs just after the LH peak. Once ovulation has occurred, if an egg has been fertilized by sperm in the fallopian tubes, a zygote forms. It takes some time for the fertilized egg or zygote to move down into the uterus, where it will implant and start to develop into a fetus. Legally, pregnancy starts at the point of implantation, and this normally occurs 8 to 10 days after ovulation and certainly no earlier than 6 days after ovulation. This is why an emergency intrauterine device may be fitted up to 5 days after earliest predicted ovulation, as we know that implantation will not yet have taken place. So how does the copper intrauterine device, or copper IUD, work? Copper ions on the device inhibit both sperm motility and function, meaning they are unable to fertilize the ovum. We can legally fit a copper IUD at any time prior to implantation. As mentioned previously, we know that if fertilization has occurred, the zygote will not implant until at least 6 days after ovulation. So, we can fit a copper IUD up to 5 days after an episode of unprotected sexual intercourse, as we know that there cannot be an implanted pregnancy present. Similarly, if we can calculate the earliest likely ovulation date, we know we cannot have an implanted pregnancy within 5 days of that date, no matter when the episodes of unprotected sexual intercourse have occurred during that menstrual cycle. Thus, if the shortest cycle is 28 days, the earliest predicted day of ovulation is day 14, so a copper IUD can be fitted up to day 14 plus 5, which is day 19. If the shortest cycle is 26 days, the earliest predicted day of ovulation is day 12, so a copper IUD can be fitted up to day 12 plus 5, which is day 17. Let's now consider oral emergency contraception. There are 2 different forms used: levonorgestrel, also called Levonel, and ulipristal acetate, which has the trade name Ella1. They both work by delaying ovulation so that it occurs about 5 days later than predicted. This means that any sperm that have entered the genital tract will no longer be viable by the time the egg is eventually released. It is important to remember that emergency contraception provides no ongoing contraception. In fact, if there is further unprotected sex a few days after taking oral emergency contraception, there will again be a high risk of pregnancy. Although pregnancy is very unlikely in the first few days of each cycle, and also just before the next period is due, we do not take any risks and will always offer treatment to anyone requesting emergency contraception where there has been any risk. Always remember that episodes of unprotected sexual intercourse close to the time of ovulation will carry the greatest risk of pregnancy at any stage in the cycle. Oral emergency contraception delays ovulation by delaying the LH surge. Levonorgestrel will only have this effect if it is taken before the LH surge begins. In contrast, ulipristal acetate may be able to delay ovulation even if the LH surge has already started. Levonel is licensed for use up to 72 hours after unprotected sexual intercourse, but will still have some effect up to 96 hours. Ulipristal acetate is licensed for use up to 120 hours after unprotected sexual intercourse. In order for oral emergency contraception to have the greatest chance of delaying ovulation, it needs to be taken at the earliest opportunity before the LH peak has occurred. Because both preparations work by delaying ovulation, they are unlikely to have any effect if taken after ovulation has occurred. However, we can never be absolutely certain when ovulation will occur, so always offer emergency contraception at any point in the menstrual cycle, even if this is after the predicted ovulation date. Equally, even if an individual opts to have a copper IUD, oral emergency contraception should still be considered in case they later change their mind or it is not possible to fit the copper IUD. The copper IUD is by far the most effective form of emergency contraception, so we need to offer it to everyone who is eligible. We can reassure individuals that copper IUDs work primarily by preventing pregnancy, by preventing fertilization. They do not disrupt an existing pregnancy or cause an abortion. Another advantage of a copper IUD is that it acts as highly effective ongoing contraception. If the individual does not wish to continue with this method, they can simply have the copper IUD removed later, once another method has been established. If oral emergency contraception is chosen, it will have the greatest effect if it is taken at the earliest opportunity. Make the individual aware that it is unlikely to be effective if ovulation has already occurred and that it is not giving them any ongoing contraception, so they need to be using a reliable alternative contraceptive method. In the next video, we will discuss how to best inform decision-making when selecting a method of emergency contraception.